Hello, welcome to this edition of Research Connection. Joining me today is Dr. Briley and Dr. Chiavaccini. Hello.
Hi.
How are you?
Good, thank you for joining us. So let's just start with a little bit about you two.
All right, I can go first. I'm Jessica Briley. I'm a third-year anesthesia resident here at NC State, and I am a so-called lifer. I also went to vet school here and graduated in 2015 and was in practice in the area for a couple of years, but couldn't stay away, so joined back up in the anesthesia department as a resident.
I'm Ludovica Chiavaccini. I actually graduated back at University of Pisa in Italy, but I've been here in the States for over 10 years now. I did my residency at Mississippi State University, and I was in faculty at UPenn before moving to NC State. So I was a faculty at NC State and was a mentor of Dr. Jessica Briley until a few months ago. And since June, we moved down to University of Florida. So I'm currently a faculty at UF.
You guys are collaborating on a grant together, correct?
Yes, so we're actually collaborating together on two projects, both of which I started as resident projects here. And the one that we most recently presented at our big ACVAA conference was about a pudendal injection, an ultrasound-guided approach in cats. So we collaborated with both Drs. Keenahan and Dr. Matthews, who are also here at NC State, to put this project together. So we essentially were looking for a way to develop an ultrasound-guided approach for cats to be able to target the pudendal nerve, which is important for lots of reasons for surgical and medical management of cats, but in particular for the urogenital tract. Really the only other option that we have for that area for a local regional technique is an epidural. And for some patients, that's either not possible or is not appropriate. And in the human literature, there's actually some potential advantages to the ultrasound-guided technique over just using an epidural. So with those things in mind, we put together a project to develop and test that kind of approach in feline cadavers.
Yeah, basically, recently it has been demonstrated, at least in human medicine, that an ultrasound-guided approach to the pudendal nerve may help not only for surgical treatment or during the surgical treatment of lower urinary tract disease, which cat suffers of, but also for the medical management of pudendal chronic pain or lower urinary tract dysfunction. So we got really interested with Jess in exploring the anatomical features of this nerve and see if such a technique was possible also in our feline patient, with the idea to use it not only for a surgical standpoint, but maybe also in the medical management of this patient, so as a palliative therapy.
Yeah, that's definitely an interest that I have. We are often thinking of techniques that we can use for surgical procedures when we're developing these techniques, but in people, if some of the same things could be true in cats, we may be able to give these cats with recurrent lower urinary tract dysfunction relief for longer periods of time than what we're able to do with current therapies.
That's fascinating. Is that the topic for both of the grants?
So the other research project that we were working on in conjunction with the ophthalmology department, so Dr. Washington, who is an ophthalmology resident, and Dr. Westermeyer, who is on the ophthalmology faculty, looking at using two different techniques for retrobulbar anesthesia. So one where we have an ultrasound-guided approach and another where we have the blind technique that's been described for many years.
Jessica's project, where on ultrasound-guided local regional anesthesia, which is one of my field of interest, but they were on two completely different anatomical areas and two different species. So
yeah,
I think that made it very interesting. Plus one was a cadaveric study, so preclinical, while the other one was a clinical study.
Fascinating. Well, it sounds like you guys are involved in great research. I'm sure you'll find more opportunities to team up again in the future.
Oh yes, I have many ideas. She won't be able to be far away, even though she's in Florida.
Well, thank you for sharing.
Well,
Thank you,
for inviting
Kyle.
me.
Best of luck.